Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, Chapter 38, Section 18, and the governor's June 16, 2021 revised order, this meeting of the Berkshire Hills Regional School District School Committee will be conducted remotely. Agenda items of those reasonably anticipated by the chair, not all items listed may in fact be discussed. Those items not listed may be brought up for discussion to the extent permitted by law. This meeting is being recorded by CTSB and the school committee recorder and may be recorded by other members of the public. Once transcribed and approved, minutes will be made public and posted to our website. So I'll call the meeting to order. I'm going to do a roll call to make sure we know who's here. Ann Hutchinson.
Aye.
Jason St. Peter.
Aye.
Sean Stephen.
Yep, I'm here.
Good. Bonnie Bon Buffoni.
She's there, Steve. I see her.
Aye.
Yeah, perfect. Perfect. Excellent. Molly Thomas.
Here.
Bill Fields.
Here.
Diane Singer. Someone just came in on a phone. It may be Diane. Corey Sprague.
Aye.
Rich Dehoney.
Here.
And here. Let me try Diane again. Diane Singer. So we have 9 out of the 10 members here at this point. There's one topic on the agenda tonight. Corey brought up at the last meeting and correctly that we owe it to parents and staff to let them know how this year is going to be conducted. So Peter, I'll turn over the COVID-19 update to you.
Okay, thank you. And I'll try to do this relatively quickly. I think since we last met, we received additional guidance from the CDC and then some from DESE and Mass DPH, and then the Great Barrington Board of Health also made some recommendations. It's pretty clear that the Delta variant is out and about in Berkshire County, and the CDC guidance was if a community was above 50 cases per 100,000 in a week, then that community should look at a range of additional mitigation strategies. When I last looked at those numbers earlier this afternoon, we're double that. So we're at 108 cases per 100,000 in Berkshire County. I think all of Massachusetts is above the 50 number, except one county smack in the middle of the state, and it goes up and down. So I'd like to reiterate a couple things. It's been our experience that students do much better when they're in school than remotely or some other context. I would like to do everything in my and our collective ability to keep school open and have students be in person. And in addition to the work we've done with vaccinations for the people who are eligible to be vaccinated, I would like to recommend and ask for the school committee's support in requiring that all students, staff, occasional visitors, and vendors wear masks in school regardless of their vaccination status. This is already required on school buses as part of federal transportation guidelines, but I'm requesting that we do it for everybody to be clear about that, to reduce the likelihood of transmission. At a different time, people would have said only do it for the unvaccinated people, but it's clear from the experience in Provincetown and many other communities that even vaccinated people can be involved in transmission. I understand wearing masks is a pain in the neck and difficult for some people. In the broader context, I think it's a small sacrifice to make, particularly to do our best to protect our youngest students who are unable to be vaccinated. So I leave it there. There's a motion that can be shared at some point around this. And Steve, I'd like to hand it back to you for school committee discussion and other folks.
So I'll take a motion first and then we'll have discussion. That way everyone knows what we're talking about. Rich, do you have the motion?
I have a motion. I move that based on guidance from the CDC, the American Academy of Pediatrics, the Great Barrington Department of Public Health, and Superintendent Dillon, that the Berkshire Hills Regional School District require masks of all students, staff, vendors, and visitors in schools, regardless of vaccination status. This approach may change over time based on shifting data and external additional guidance. The superintendent will update the school committee at each future meeting regarding the status of the mask requirement.
Do I have a second?
Second the motion.
So I have a motion by Rich, a second by Bill. Discussion.
I thought that we already had a policy of mask wearing that was enunciated last year in mid-August. Is that still present, or did we at one time that I didn't know drop it? Because it still seems to be on the books. I mean, I have no problem with this, but I'm wondering if it's redundant.
It probably is redundant, but we want to be very clear
Okay.
to everyone. And then there is a new policy that we will discuss in a few minutes that just came out this afternoon from sample policy from MASC that we may talk about also. So,
okay.
But I think it's important that everyone understands where we're heading as school starts.
Okay.
Yeah.
Anyone else?
At worst, it's redundant. Now everyone's very clear that when they come back to school, they got to have masks on.
Okay. So I see no one else hands up. No one is speaking. So, and I will take public comment too. I mean, so seeing none, let's have a roll call vote. Ann?
Aye.
Jason?
Aye.
Sean?
Aye.
Bonnie?
Aye.
Molly?
Aye. Aye.
Bill? Thank you.
Yes.
Diane? She's not here. Corey?
Aye.
Rich?
Yes.
And I, it's unanimous. Peter, do you want to share the policy, or Rich, do you want to talk about the other motion first?
I leave that to Peter. Peter wanted to.
Let me share the policy. So again, this is a little unusual. This is hot off the presses from MASC, the Massachusetts Association of School Committees. They sent this out to all their members this afternoon. So I'm really just seeing it. I think, Bill, it's a more updated version of our existing policy. What I'm going to do is I'm going to share my screen and we can go through it. Normally, a policy would go through the policy subcommittee and then be referred to the whole school committee. In this instance, because it's quite timely and time sensitive, I'm going to recommend we bypass the policy subcommittee. We go straight to the whole school committee. And if you're so inclined, after you review it, that you potentially vote to accept it tonight. So let me just share this policy. Okay, are you able to see it?
Yep.
I think you need to expand it. Yeah, there you go.
Yeah, sorry.
Okay, good. Yeah.
Okay. So start reading it. I mean, I could read it if you want me to, but I think you can all read it yourself.
There may be people on phones.
Okay, so let me read it.
Yeah, please.
And I just got to make you guys go away. So the Berkshire Hills Regional School District is committed to providing a safe environment in schools during the ongoing COVID-19 pandemic. Maintaining a safe environment is critical to the district's ability to returning students to full-time classroom learning experience. According to public health experts, one of the best ways to stop the spread of coronavirus and to keep members of our community safe is the use of face masks or face coverings. Therefore, using guidance and recommendations from the CDC, the Department of Elementary and Secondary Education, and the Mass Department of Public Health, the district has established the following requirements, which will remain in place until further notice. A face covering that covers the nose and mouth will be worn by all individuals in all school buildings and on school transportation. Face coverings must also be worn outside when social distancing cannot be observed. Individuals may be excused from the requirement for the following list of reasons per CDC guidance. The individual has trouble breathing, is unconscious, is incapacitated, cannot remove the mask or face covering without assistance. In addition, masks or face coverings will not be required for anyone who has a medical, behavioral, or other challenge making it unsafe to wear a face mask or face covering. A written notice from a physician is required for requested exemption. Parents may not excuse their child from the face mask requirement by signing a waiver. Additionally, face masks or face coverings will not be required when appropriate social distancing is enforced, during mask breaks, while eating or drinking, during physical education classes while outside. Exceptions to this policy under certain circumstances, such as for students with medical, behavioral, or other challenges who are unable to wear masks, must be approved by the building principal in consultation with the school nurse or local board of health. Face shields or physical barriers may provide an alternative in some instances. A student's mask or face covering is to be provided by the student's family. Staff members are responsible for providing their own face coverings. However, the district will supply disposable face coverings for an individual who arrive at the building or on board school transportation without one. If students are in violation of the policy, the building principal will consult with the parents and guardians to determine whether an exception is appropriate, or the student may be removed from the school building for in-person learning until such time as they can comply with the requirement or the requirement is lifted. Violations of this policy by staff will be handled in the same manner as other violations of school committee policy. Visitors in violation of this policy will be denied entry to the school or district facility. This policy will remain in place until rescinded by the school committee. And then at the end of it, it references guidance statements to the Mass Department of Public Health, to the CDC, to the Center for Disease Controls, connected to public transportation, and to DSC.
So if someone would like to make a motion to adopt this policy, and then we'll have a discussion.
And the name of the policy is EBCFA, policy on face coverings.
I make a motion that we adopt the EBCFA on face coverings.
Yeah, and you win a prize for short-term memory.
Do I have a second?
Second the motion.
So I have a motion by Ann, a second by Bill. Discussion. I think this allows us to be very clear on our procedures. So, Corey, go ahead.
I guess just not being familiar with what got voted in last year when we first approved face coverings, how does this differ from what was in place previously?
I think and this is just a high level summary, Corey. I think the language on exceptions is clearer, and I think the sentence, parents may not excuse their child from the face mask requirement by signing a waiver, is also firmer. And then obviously all the guidance at the end is new and didn't exist when the last policy. I think that catches most of it. I might have missed something, but I think that's most of it.
Eileen Mooney, go ahead.
Hi, I just wondered if somebody could send me a copy of that as soon as possible.
Absolutely.
Yeah.
Thanks.
Peter,
I'll
thank you.
do that. Yeah.
Thank you. Anyone else? Valerie Ivy.
Yeah, I have a question coming from the high school. I know last year we had conversations around face coverings versus masks, and finally it was decided that it had to be a mask and that it couldn't be a face covering. I'm just curious with the wording of this, where we're going to land on that this year. Thanks.
As far as I'm concerned, it's still a mask. By reading this and by looking at CDC guidance, face coverings still not acceptable. Peter, do you agree with that?
I agree. For a while, it was popular for people to wear those, I don't even know what you call them, buffs or tubes, right? But
gaiters, I think they call them.
Gaiters, yeah. Right. So I think a mask is a mask, and that's what the expectation is. And actually, I'm surprised that they use the language face coverings as opposed to masks.
Anyone else? Seeing no one else, roll call vote. Ann?
Aye.
Jason?
Aye.
Sean? Aye. Bonnie?
Aye.
Thank you. Molly?
Aye.
Bill?
Yes.
Corey?
Aye.
Rich?
Aye.
And aye, it's unanimous. So we have one more issue to take up. Rich, do you want to take this one?
Sure. Do you want a motion first, or
That's fine.
Okay. I move that the Berkshire Hills Regional School District require all staff to be vaccinated against COVID-19. Individuals may request specific exemptions in writing for medical reasons. Medical exemptions must be supported by documentation from a medical provider and approved by the school nurse and the superintendent. Individuals may request exemptions in writing for religious reasons that must be reviewed and approved by the superintendent and the district legal counsel.
Do I have a second?
Second the motion.
Discussion.
I would like to put a time frame on it.
Excellent idea. We did talk about that today, briefly. Or Rich, do you want to add a time on that?
Yeah, I guess, can I just add it now, or do I have to do a motion to amend?
Just add it.
Shall be vaccinated by September 15th.
That's fine. That'll give, if we send the notice out, they need to have their first shot by September 15th.
Right.
That makes the most sense, so that we don't run into the 21, 28 day conundrum.
Steve, is this going to involve any negotiations with the Teachers Association?
Peter?
It very well might. This is interesting, right? So my belief is upwards of 94% of our staff are already vaccinated, and the small number that aren't are likely not vaccinated for medical or religious reasons that would meet our, or potentially could be addressed through the exemption process, right? Through requesting an exemption. I think this is the kind of thing that this could or should be bargained in the context of impact bargaining.
Right.
And that would be with our three bargaining groups, so the teachers, the paraprofessionals, and secretaries, and then the cooperative group, which represents I think everybody else. But I do know that the wide, if not super majority of our folks are already vaccinated. So I think this is going to impact a very small number of people.
Christine Lucy, you have your hand up?
I'm wondering, I'm actually speaking as the new president of the BHEA, so thank you guys for having us here. Peter, I'm wondering if the numbers of staff and other folks in our district that aren't vaccinated yet, if it warrants holding an on-site clinic to try to catch folks.
That's a really good idea. And I'll reach out to Heather Barbieri and folks to see if we could do that. I don't know. Again, like the total number might be countable on two hands, and maybe that's a convenience we can afford people. But I'll try to. A lot of people shared with me that they were vaccinated, but my data set's not perfectly complete.
The other choice, if that doesn't work out, is, and this is for anyone, is that Monday through Friday from 9 a.m. to 2 p.m. at Fairview, there's a walk-in clinic. You can get Monday through Thursday, either Pfizer or J&J. Monday through Friday, you can get all three of them. So if it's such a small number that maybe we can't get a clinic, it's easy just to walk into the hospital and get it. You'll probably be there half hour, 45 minutes, and you'll be done with it.
I'm not going to make a motion on it tonight, but I would like, when we're done with this matter, to have a discussion about vaccination of students as well. So maybe an on-site clinic that dealt with both staff who aren't vaccinated and students who aren't vaccinated.
Rich, that's for the next, that's absolutely for our next meeting.
Yeah.
Absolutely.
Yeah. Let's go with Becky next. Just state your name for the name for the record.
Becky Chupons.
Yeah, thank you.
School nurse, Muddy Brook. Okay, so as far as the exemptions go, I know this is just the school nurse and me talking. When students have a religious exemption, I mean, the only two exemptions you can take in this state are medical or religious. And when the state says we're not allowed to question the religious exemption as far as what religion or anything like that, that's sort of just putting that out there. And if we're requiring staff to be vaccinated, then are they going to have to, I know people, I'm not quite sure why, have an issue with presenting their vaccination card. But if we're requiring it, then they're going to have to bring in their COVID card. We have a way to access it through the state, but I don't think we can do that without the permission of the staff member.
So Becky, there's two ways we can work out the details. Either we can require proof of vaccination, or I assume, and I'm going out on a limb, they can sign a disclosure so that you can access it.
Right.
Yeah.
So that would be a good way to do it. Then we can just look it up through that state website.
Yeah.
And
either way makes sense.
And I don't know if, I guess the lawyer would have to answer whether we can ask what the religious exemption, I mean, or medical, but anyhow, just putting that out there, because I think some people will have to use a religious exemption. I'm not sure how else they won't get it if it's a requirement to work. But that's that.
Thank you, Becky.
Okay.
Corey, thank you.
My question was around the proof of vaccination, so I'm all set. Thank you.
Perfect. Anyone else? Seeing no one else, let's go through a roll call vote. Ann Hutchinson?
Aye.
Jason St. Peter?
Aye.
John Steven?
Aye.
Bonnie Bon Buffoni?
Aye.
Molly Thomas?
Aye.
Bill Fields?
Yes.
Corey Sprague?
Aye.
Rich Mahoney?
Aye.
And I vote aye. It's unanimous. Peter or Rich or anyone have anything else?
Could just for the sake of the public and for my own, can we reread what we just voted on? Can it be reread with the date added, so everybody's clear on it?
I can do that if you'd like.
Yes,
Rich. Thank you, Rich.
I remove that the Berkshire Hills Regional School District require all staff to be vaccinated against COVID-19 by September 15th, 2021. Individuals may request specific exemptions in writing for medical reasons. Medical exemptions must be supported by documentation from a medical provider and approved by the school nurse and superintendent. Individuals may request exemptions in writing for religious reasons that must be reviewed and approved by the superintendent and the district legal counsel.
Thank you.
Corey, go ahead.
I guess in terms of other questions, I just wanted to ask about whether or not we will be doing pool testing again in the fall when school starts. And then also if there will be any conversations that are happening prior to school, if we get to a point where distancing requirements come back into play.
Yeah, so I'm going to participate in a webinar tomorrow on pool testing. It appears that the state will again cover the cost of that. And it's my strong interest and commitment to continue to participate in pool testing. I'll know more after that webinar tomorrow, and I may send an update, but I just see it as another tool in the toolbox. And Corey, I was thinking about that part. Remind me on the second part of your question.
Just distancing, if there are any preliminary discussions happening about what things would look like if distancing requirements came into play again.
Yeah, my real commitment is to try to keep us in school full time. The guidance around distancing from the state level expired or evaporated. I think within buildings we'll still try to adhere to the 6-foot distancing, and last week the administrators and I talked some about maintaining some of the things we've done around traffic flow and some of our other fall strategies to mitigate things. But I think we did a big check multiple times last year on air exchanges, and we're in very good shape there. I think having everybody be masked will be a very successful mitigation strategy. And then we'll go to distancing, sanitizing, and some of the other things. We spent a lot of time last year sanitizing, and in hindsight, that probably wasn't as impactful as we thought it would be at the beginning of the pandemic. So hopefully that clarifies it some.
Anyone else?
I'd just like to follow up on what Corey said at the last meeting about how we should be ahead of the game, and despite what the state says. And also it might be that we should in some way communicate that if the measures that we have voted on tonight are not successful in regards to the transmission and the number of positive cases, that there is a strong likelihood we would have to go remote and get into that area. So I think people should know, and maybe we should, as a district, not just feel that we're going to go in person, that there are things on the horizon that may force us to look at doing what we did again last year.
We don't have the authority, Bill. We can only go remote with authority of the commissioner and the governor. They rescinded that in April.
Okay, I didn't. Okay.
Yeah, so there's that's not even a tool in the toolbox unless they say we can.
Okay,
that's a done thing.
Done deal. Okay.
Yeah.
Well, we hope it's permanently done, but
Right. Yeah. No, I was just concerned about the if these measures don't work. Okay.
And there are a couple hands up, and Steve, you could call them on in a sec. I'm gonna try to make a real commitment to do this in a data-driven way, right? We have a very specific metric from the CDC. We'll see those numbers go up and down, and we'll make adjustments both ways. If it gets worse and there's something we can do, we'll make adjustments. And if it gets better and there's something else we can do, we'll make adjustments.
so let me go, and I'll take you after. Valerie Ivy.
Hi, yeah, I'm following up on Corey's question in terms of distancing, Peter. And I guess what I'm wondering is, having been up in the high school recently, like we're not even at, I don't even think we're at 3 feet in some of the cases. And so I'm wondering if there's going to be anything specifically stated that needs to be happening, or is this just everybody's going to be in masks and other than that, we're, maybe moving in a different direction. But in terms of numbers in classrooms, in terms of distancing, that's to play it by ear?
No, there'll be very clear guidance on it, but I'm not ready to share that guidance today. I imagine between now and when school starts, there'll be 3 more memos from the commissioner and the governor and better guidance there. So tonight we're doing the mask thing and the vaccination thing. Stay tuned, and in the coming weeks, I'll share additional clarity there.
Thank you. And I'm not trying to give you a hard time at all.
No. I totally appreciate it.
Like, none of us wanted to be here again this August. Absolutely.
No, this was going to be the normal year, and it's not quite the normal year, but we'll figure it out, and there will be clear guidance and formal opportunities for negotiations where, like, it impacts working conditions, whole host of things, and I'll continue to share updates.
Thank you.
Yeah, cool.
Nurse Becky.
Yes, sorry, and maybe Peter, that this is something you'll address later, but in the elementary school specifically, I'm trying to get ready for the new school year, and as you know, food allergies are a big thing. Are kids going to be eating in the classroom again, do you know? Or is that just something you continue to think about, or will we use the cafeteria?
I think that the answer is and in both. So in some instances, kids will be eating in classrooms. In other instances, the cafeteria. My sense was the kids with allergies last year ate in the cafeteria because it was a more controlled environment than eating in classrooms. And we've started talking about that. We'll probably maintain that practice. The elementary school is a little different because we made a really concerted effort to redeploy staff so class sizes could be smaller, and in some ways that works really well. But we've been talking a lot about where people are eating, lunches, lunchrooms, what happens, and I'll do some more talk with that with the principals, and we'll check in with the nurses, and then we'll share information. But I think all the strategies we used last year that were successful we'll continue to use, and we may make some small adjustments.
Okay, perfect. Thank you.
Thanks, Tim. Ann Hutchinson?
Yeah, a couple of things. The motion we just passed about the teachers or staff getting immunized, does that mean everybody's immunized by complete immunization by October 15th?
I think we said first shot by then.
The first shot by September 15th, yeah. So,
September 15th, right? Okay.
What you're saying is true, right? Yeah. If they get the first one, then they're eligible to get the second one.
I'm not quite sure it said it when it was last read, that it was first shot by the 15th. Okay, September 15th. I agree with certainly what we think we've learned is that all that cleaning surfaces is not so helpful, and masking is helpful. I think having an immunization clinic at the high school would be a great idea to try to catch, at least catch the kids who turn 12 over the summer, right? That we try to really make a push that we'd like the school age kids, the 12-year-old kids and up to get immunized. Well, that's what's going to make it safe at the high school. And then the other thing is trying to get parents and guardians to sign for their kids to have that group testing, because that's what's going to tell us what's going on. So I think it's trying to put our energy into that and not so much into 6-foot distancing, which we probably is not so helpful anyway. As long as there's good airflow, kids are masked and then immunized. Okay.
Thanks, Sam.
I'll
Anyone
add
else
on that too. Is I hope the clinic is great, but we have got to exhaust everything we can do to non-compulsory encourage all students who are over 12 to be vaccinated. I just personally think it's the right thing to do. I've also will bet anyone right now that once the CDC gives a permanent approval to it, the state's going to require it. And I don't want a fire drill of a bunch of kids who aren't allowed to come to school. And that could happen as early as October. So, I mean, I think at this point we lead with the carrot because I think the stick is coming anyways.
And Steve, if it's okay, just one other thing I'll share. And I think there's some confusion about this. Last year, the state allowed us to participate in remote learning. That is not the case this year. Remote learning is not an option for our students. We're not going to be teaching classes and streaming them simultaneously. We're going to focus our efforts on in-person learning. Some people wonder, can my child participate remotely? In this year, one cannot. There are two sponsored programs through the state that are entirely remote learning. And if people wanted to do that, they could do that. Or the other alternative would be for parents to apply to homeschool their children. But to be crystal clear about it, we are not supporting remote learning this year.
Anyone else? Thank you, Peter, by the way. Well, we got a lot done in 36 minutes. That was a good meeting. So by unanimous consent, we are adjourned.
Okay.
Thank you.
Thanks, everybody. Have a good night.
Thank
Good
you.
night, guys.
All right.